Hi, welcome to Medical Emergency. This lecture is going to be about office preparation. Be prepared. An emergency is a condition or circumstances requiring immediate action. I'm going to tell you a little story here. So in our office, we have all the proper equipment. We have the oxygen tank, we have the medical emergency kit, we have the Ambu Bag. The problem is we did not have it all in the same place. There was an emergency that happened across the street. Somebody came running in saying there was a young girl collapsed. We went running out. Unfortunately, it was one of our patients. We were shocked that. And she was a young girl going on her way to school, and she was doing drugs. She overdosed. She vomited. She was laying there unconscious in her own vomit, not even breathing. So, we did take care of her. We did do CPR on her. We gave her oxygen. We called the ambulance. But the problem was there were so many people running across the street in the traffic. We did not have everything in one kit. Since then, we got a big bin and we put everything in it, including gloves and masks, because now we're dealing with vomit and you want to touch that with a person that you didn't really know, and it was tricky. So after that episode, we learned not only do you have everything that you need, but you have to have an action plan. You have to have everything in the right place. High-risk patients for emergencies are your pediatrics, your children, your geriatrics, and anybody who's medically compromised. And you want to check and update their medical history every single time they come in. This is a sample of an emergency medical kit. Protocol for maintaining this. It has to be checked weekly. Anything that is outdated or expired or used has to be thrown out and replaced. One staff member should be assigned this responsibility for keeping this updated. All staff members, however, need to be familiar with the kit, and you have to use universal, now it's called standard precautions, are always used. Injectable drugs. So this, of course, is only used by the doctor. Epinephrine. Typically you see an EpiPen. You've seen that very common. A lot of school kids, a lot of people carry them, regardless of school kids, all ages. Somebody's allergic to peanut butter, to bees. They will carry an EpiPen that you have to inject. The doctor might use epinephrine that's right there in the office. Antihistamine. This is something for more of a long-term reaction where the EpiPen is immediate. This is like a sample of Benadryl. Here's my story about this. There was a young girl. I used to do daycare for a short time, and we had a young girl, and she was out with her parents, and she was about 4 years old, and she was highly allergic to peanut butter and to peanuts. And she went out to Friendly's, and Friendly's used to have Reese's Pieces that they would have in their sundaes. They did not order that, but by mistake, whoever was making the sundae, one of those Reese's Pieces dropped in this bowl, this young child's bowl. And so while they were sitting there, she ate this Reese's Pieces, and within seconds her throat closed up, and she was going into what's called anaphylactic shock. Luckily, there was a pediatric office right across the street, and so they picked their child up and ran across the street. They shot him with epinephrine, with an EpiPen, and the child was fine. But that's an immediate reaction. Somebody else who might have something that break out in a rash, the rash slowly came and it might last several hours, that's something that you would use like Benadryl for. This is for seizures, anticonvulsants. Again, this is something the doctor would use. All of this, of course, is from the doctor. Narcotics Antagonist. So this is used against anybody who is having a drug overdose. Non-injectable, which means something you might take orally, is like a baby aspirin. This is for palpitations. Nitroglycerin for chest pains, and tubes of frosting. This is for diabetes. They'll use the frosting underneath their lip for quick sugar. Or smelling salt. This is for if somebody sometimes faint, and you break the smelling salt in half and you wave it under their nose, and they would come out. Inhaler. If a patient has an inhaler, it should be ready to use. So when you're reviewing the health history, have them take out their inhaler, even though they say, I don't always use it and everything else. Excuse me, in a dental office, they get nervous. And so it's just better to have that inhaler right there, either on their lap or on the bracket table or someplace or on top of their purse or wherever that you see it and they're not digging through something to find it in case of an emergency. Ambu Bag. This is to force air into the patient. Oxygen. Most important and most used. We sometimes use this at least several times a week. People get nervous in the dental office and they faint, and so you have to give them oxygen. We're going to go over this. When you come into the clinic, your instructor will go over how to use the oxygen tank, and these are the parts of the oxygen tank. Emergency plan. Be prepared. Have an emergency plan. Practice that plan and stay calm. We had a dental assistant that she did not stay calm. She was this hyperactive person that no matter what it was, I mean, especially having oxygen, I mean, it's extremely common, but she would go running through the office, emergency, 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 and getting everybody more anxious. Not what you're supposed to do. Staff training. This is done annually for any current employees. You must be trained immediately for all new employers. Extra training comes out if something new or a new protocol happens. Records of this training must be kept, and the staff must have current CPR certification. Roles. The clinical auxiliaries, they alert the doctor, they activate the emergency plan, they retrieve the oxygen tank, they retrieve the emergency kit, CPR if needed, if they're going to start that, and they assist the doctor with preparing any kind of emergency drugs. That's why you have to be familiar with it and how you prepare it, but of course you do not administer or make a decision to administer anything. This is all the doctor's call. You are going to have an exercise at the end of this course, and it's called mock emergency, and where you're going to kind of role play all of this, and you're going to set up who's going to do what in different scenarios. What is the role of the receptionist? She's going to alert the doctor and activate the emergency plan. A lot of offices might have a light system, and a certain light system will be, that means an emergency. Like, here's the emergency, and on that light thing will say maybe room number 2, and that's when you know everybody has to go. But if you have a multi-doctor's office and Dr. Smith is having an emergency, Dr. Jones' staff may not go. You know, it all depends on what it is. Have all the emergency numbers posted. You're going to call 911 if needed, and you're going to wait for the EMT to direct to this is where the patient is, and you're going to keep all the other patients calm. You're going to have patients in the waiting room. Something might happen, you know, especially when you're giving anesthesia, especially when the patient's nervous, or you might be doing an extraction. Emergencies happen. What is the role of the doctor? Of course, it's going to diagnose the patient's emergency. It's going to decide whether or not to call 911. It's going to administer any drugs if they need to. It's going to start CPR if needed, and it's going to monitor the patient. Keep your patients safe. Thank you very much.